We're live.
Hi.
Hello. God, here.
What?
There you go.
Do you want to be in this?
Yeah.
Here.
Perfect. All right.
All right. Hi, guys. Hey. So I'm Jamie. This is Dr. Colin Consales. Do you see what happens every time we do these? I'm like big head Jamie.
Because I sit way
Because
back
he
here.
sits way back here. If any of you have never met me before, my head, it's not this big in comparison to his.
Mine's actually really small. So.
So I am not Big Head Jamie. Thank you guys so much. I am Jamie Weiland, though, and I have the pleasure of working here at Integrative Health and Wellness. As you can see, we pretty much have a good time like this most days, right?
Yep.
And I have the pleasure of meeting with you guys every Wednesday at 5:30. Usually we do them at 5:30 here. And I get to pick the brains of him and the other doctor that works here, Dr. Sarah Vivona. She's actually teaching a class right now. So anytime that I'm with one of the doctors here, the other doctor is teaching a free class that you guys are all welcome to come to learn a little bit more about what you guys do, how you do it, why it works.
Yep.
Which is pretty cool because I don't know any other doctors that are teaching classes themselves.
Yeah, it's really interesting, too. We try to keep it fun and upbeat. It's not like sitting in a boring, whatever, math class.
This is true.
Yeah.
And I have watched it, 3 times. Mm-hmm. I've gotten something different every time.
Yeah, and we changed around a little bit, too. We're always updating it and making it more relevant to the current times.
So you guys are always welcome to that. Tonight's topic is super cool. So we titled this, Are Your Dogs a Barkin'? I know that this is like such a bad time for some of our followers because a lot of our followers are, working moms or even just moms who are right now cooking dinner. So unfortunately, I can't get a bunch of you guys on screen because I would love to know how many of you know what that means. Obviously, I wasn't the one who came up with it. So I'm learning something every day. Are your dogs a barking is...
Your feet hurting. So at the end of the day, you sit down on the couch, you're like, oh, my dogs are barking. It's a common saying, I think. I don't know.
My husband doesn't watch us, so I'm absolutely going to go home and
say it and see if he knows what it means.
I am going to find out, is this a guy thing? Oh, man, my dogs are barking.
Yeah.
And we don't have dogs, but I do have feet, and that's what we get to talk about tonight is feet health, foot health, feet health.
Foot health.
What are your feet telling you?
Yep.
I love this because, as you guys know, I was a patient here for over a year before I was offered a position. And he actually went over some feet things with me because I have a herniated and bulging disc with stenosis. And I'm hardly in any pain. Thank you.
You're welcome.
And so he did this to me, and it was so funny because, I never have any clue what you're doing or why you're doing it. And I actually joked one time with you and said, I'm going to take you shoe shopping with me one day.
Yep.
Right? Because what we're going to get into is, how important is this anyway? Right? So how important are our feet to our well-being, to our overall well-being?
They're extremely important. So they're the part of the foundation, they're the platform that you stand on. So if the positioning of your feet are off, then that can, you have what's called a closed kinetic chain. Basically what it means is every little alteration down low or up high is going to affect you in the opposite direction. So if you're standing and your foot's slightly like this, it's going to tilt, your body's going to compensate and want to straighten out at some other area, just to keep you straight from leaning all the way over this way for foots like this, right? So that compensation is either going to come from the knee is going to tilt this way, or the hip's going to tilt this way, or the spine's going to tilt this way, and that movement's going to cause inflammation or pain at that location. So all of these things need to be positioned properly and be able to stabilize themselves for proper function in the body.
So is this why you have patients walk up and down the hall?
There I'm looking for how they're actually walking or moving. So we can tell a lot by how people are swinging their arms, how they're moving their legs forward, back, how their feet are hitting the floor, if there's a shift to one side or the other. Those are key indicators of different muscle weaknesses and instability that we correct here at the clinic. So yeah, we'll have people walk sometimes because some things will show up with gait or walking. which won't show up if you're just standing looking at posture. So we want more of a dynamic movement analysis involved with that.
And so, how about shoes then? I'm assuming shoes are pretty important because they're going to alter how we're walking.
Absolutely.
So, what is a good
Like how
shoe?
to find a good shoe?
How do I find a good shoe? Are I was going to say thugs. What are they
How
called?
to find some good thugs?
What are the
Uggs.
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 Those
I'm like
boots.
hugs, bugs.
Yeah.
What are these shoes called? Like, yes, are Uggs good shoes? I'm assuming high heels are probably out of the question.
Yeah, so whenever you have like a high heel, all that pressure is going on the balls of your feet, and that's going to cause a major shift in how your foot's functioning. So you arch your feet, not only does it jam all the pressure on this part where it's supposed to be flat, like there's supposed to be a dispersal of weight, or weight distribution, I should say, proper weight distribution, but if you're like this and your heel's over here, that actually causes your back. This is why you wear heels. It makes your calf muscles contract, so it makes your calf muscles look thinner and more toned, and then it sticks out your butt, and then it arches your back.
Oh.
So you stick out your butt, stick your chest out,
I'm
and it makes your legs look thinner, and that's why women want like high heels, because it changes their posture, but it has a lot of significant changes to the body because it's an improper position. So if you're wearing heels, you can damage your feet, you can compress your low back too much, which are two main things that it does, causing low back pain and issues like that.
This is really disturbing, I gotta say, like, as a mom with teenage girls.
They want
Because,
to wear heels.
well, my girls thankfully don't, but they are being marketed, like, our society is marketing these shoes that have tennis shoes with the lifted arches inside the tennis shoes, which I think is just, I mean, not working here. You just have to, that has to be bad because they're running, these are tennis shoes, so they're running in them.
And you're developing too, in that position. So you have compression forces in different areas which shouldn't have compression on them, and if that's repeated over and over again while your body's trying to develop, your bones will actually change as they're growing. If you're wearing those shoes constantly, they'll actually change and they'll wedge differently than they should, the bones.
Oh.
Which is kind of like what happens with scoliosis. If you catch scoliosis early before the bones have completely developed, then you can reverse it by fixing the muscles. But if you don't, those bones grow in that odd wedge shaped and you cannot reverse it.
Wow.
So yeah.
I love that. We weren't even planning on that going there.
No.
Okay. And then, so I do have some questions planned out for you.
I did have something else to say that I forgot.
Oh, good.
I thought it was pretty neat. I actually drew you guys a picture. So this here, let me see. Got some shadow. See, it's a foot.
So this basically means if anyone's been to our office,
a lot of people have done this before.
they know that any of the drawings now that are on display here at the office did not come from you. If this is your drawing.
So I didn't draw this. This is a trace. I traced the foot, okay? But yeah, I'm not very good at drawing. So this is actually Dr. Sarah's foot. I did it right before we started. And what we do, this is to help you pick out shoes, and anyone can do this. It's very important, okay? So what we do is we use a clipboard, just stand on any solid, firm surface, and have whoever's around you, you put pressure on one foot, so stand on one foot, and you have that person trace your foot with a pen or pencil onto the sheet of paper. Whenever you stand on and put weight on your foot actually, the compression causes the bones to spread, and it works like as a shock absorber. And in that position is the position that when your foot's like that, you want to trace out your foot, and then you use this picture whenever you go shoe shopping. And what you do is you put whatever shoe you're planning on buying right over top of it. And when you've put it right over top, you'll line just one of the sides. I always use like the outside of the foot with the outside of the shoe. And if you see your foot outside, like if you see the line of the foot outside of the shoe, whenever you put it directly on it, then you know that shoe is too small. And if you buy a shoe that's too small, your foot needs to expand when you walk. If it's not and it's being compressed, then you can develop a lot of foot problems. And also, because we talked about that kinetic chain, a lot of different functional problems in the body as well. So that's like a key thing that we do here, and you can do on your own for shoe shopping to make sure that you're getting proper shoes and not irritating and causing foot problems, and along with a lot of other problems.
This is what we need to do to not have to take you shoe shopping.
Yeah, I'm an expensive date with
I
shoe
was
shopping.
just thinking, you are an expensive shoe shopper.
Yes, it's going to be pretty pricey. So we don't need to do that. You could do this.
The other thing, though, that we do as patients of yours
Mm-hmm.
and Dr. Sarah's, I mean, I know a lot of us, we go, we buy our shoes,
Yeah,
and we bring them here.
absolutely. So the insoles of the different shoes, they vary. And some of them have higher arch support, lower arch support. Some of them actually tilt or squeeze the foot differently. And people's bodies will actually physically respond differently to those shoes immediately. So what we do is we test a muscle's strength that's involved with walking. So we're looking at gait or walking, which is what we do a lot of the day. And so we'll test like a pec muscle, because that muscle is involved with the arm swinging forward. Your pec muscle needs to turn on. So we'll say test the pec muscle, and we'll push up and out while you're standing on the floor without any shoes on, any feet on. And then what we do is we have you put your shoes on, lace them up the way you normally would, and test that muscle again. If that muscle is now neurologically weak, that's an indication that the shoes are no good, or the insole in that shoe is not good for you.
So when you say like neurologically weak, it just means that if
The-
I have my hand out,
The muscle is no longer, so we're going up and out, the muscle is no longer locking. So I push on it, it locks hard. What we do a specific type of neurological muscle test that's a gradient increase in the pressure. And as we increase, that muscle should get harder and harder and harder. If the lock is not there, it's going to get weaker and weaker and weaker. And it's through that test, if we're testing a muscle that's involved with walking, we're tapping into the portion of the spinal cord's like relay system for walking and standing and posture. And it's telling us specifically whether or not that shoe is going to be good for our posture and walking or not.
I always love whenever Dr. Sarah tests me on things like this, because Dr. Sarah is literally half of my body, and whenever I have something like this, like the wrong shoe on, I really cannot fight her.
Yeah.
And she's the
You could
littlest
overpower
thing.
her easily, yeah.
And yes, and I just, whenever it's wrong, I totally cannot overpower her, and she's so little. So it's so funny to me when you feel
She does-
that.
Yeah, you could definitely feel it. And it's not a strength test, it's like a locking test. And if it's not locking, anything can overpower you that way.
So then you mentioned, the inserts on shoes. I mean, should we be buying, I know there's, machines that you can find at Walmart even that you step on, tells you that. There
like
are
Dr.
different,
Scholl's and
yes, and even different different chiropractors,
foot levelers and
yes,
things like that. Yep.
and those are expensive.
They are. They're very expensive. My clinical opinion is that they're a crutch. So they're like, and they cause problems in the long run. So when do you use crutches?
When something's wrong.
Right. Whenever there's something healing up and not repairing properly, use a crutch. You don't want to be on crutches for the rest of your life, right? Because what are you not using when you're on a crutch? One of your legs, probably, right? So if you don't use your leg for a long period of time, what do you think happens to the muscles there?
So they're weak.
They start to go really weak and they start to deteriorate. And so that leg gets really super small because we're not using the muscles. So if you don't use them, you lose them. The same thing happens in our feet. So whenever we're using these things to hold our feet in different positions, the muscles of our feet aren't holding the foot in the proper position, and we're weakening the muscles of our feet. So what we want to do instead is we want to work to see which specific muscles aren't holding the feet in the position and allow the muscles to do the work. So specific foot exercises, and then making sure that everything's firing properly on a neurological level. That will keep the foot where it should be without having to use the crutch.
So I love this because it's maybe using it for a short period of time
Yeah.
as the Band-Aid.
As a Band-Aid, but that's really all. We don't use them here at all at the clinic.
I know I had them for a long time, and I would just go buy any shoe I wanted because I'd put my levelers in.
Mhm.
And then you actually told me, to take them out and not use them. And I was really afraid just because they worked for me before.
Yeah.
But then I took them out and
Didn't need them. Yeah.
it's just amazing and wonderful.
It's pretty interesting because you'll, like, say someone has a dropped arch. What happens whenever someone has a dropped arch is, so the arch, so it's supposed to be like this, the arch collapses, so your foot tilts in, and when that happens, the toes go to the side, which creates a bunion there. So if your toes are going to the side, like your big toes starting to slant off to the side, sorry, it's not good, so it's like that, and this is the bunion here, it's that joint in your big toe. That's because that arch is collapsed. Now, to strengthen that, the muscle that holds up the arch is called your tibialis posterior, and it's wired to your adrenal glands. So your adrenal glands are like your stress hormone glands. So a lot of times what we find with people with foot problems and arch problems is that their adrenal glands are fatigued. And a solution for that, so those are your stress hormone glands. So the more stress you have in your life, of course, the more they're going to be beat up, or the more toxins you have floating around in your system, or, a number of different things. A lot of different stressors in life. So repairing the adrenal glands actually neurologically strengthens that muscle up again, and then the arch comes back to the normal position. Whenever
Will they straighten out then?
Depends on how long it's been.
Okay.
Because
I mean, I know some women who have.
They're bad, yeah, and those ones they're really hard and difficult to change because the foot is actually deformed to be like that.
You've stuck like that way.
Yeah, the ligaments have been stretched so hard that it's really difficult. That would be a good time for maybe a crutch, like a support, while you're working to strengthen that and bring it back. But there was something else I was going to say about that, and I forgot. But so the same thing happens. That's what causes plantar fasciitis. So what happens is whenever that arch, you have what's called fascia that is on the bottom of your foot here, and your fascia is like saran wrap, and there's a really hard portion on the bottom of your foot. So whenever that fascia is like this, so whenever you collapse that arch, it lengthens, and at the attachment point back here of that's where you get that pain, plantar fasciitis. And so it's actually from a collapsed arch.
So can somebody get plantar fasciitis from a sports injury?
Yeah.
Okay, because that's the arch.
Yeah.
It would just be the arch
and
collapsing.
Yeah, exactly. And, if you don't mind me talking about
your
daughter. So she came in last week, I think, and her arch was bothering her. And
always.
Yeah.
I mean, it bothers her so much for the last 3 years from a soccer injury that we've been to Children's Hospital and other chiropractors that told her this was just something we were always going to have to deal with because she has plantar fasciitis from this.
Yeah.
And the shoes we had to buy are like $150, $250 shoes.
Yeah.
So it's been really crazy. And even just walking in the mall with her, like we just walk.
Yeah.
And it bothers her. Her foot bothers her.
And so like with her before she left, she didn't have it, right? So what I did, I was pushing on the bottom of her arch, and I was looking for irritation. That's like your sciatic nerve. You've heard of sciatica. It just travels all the way down to the arch of the foot. Okay, so whenever you have plantar fasciitis, it can be the plantar fascia, or it could be irritation on that nerve itself. So you have to see which one it is, because it could be one or the other. With hers, it wasn't even plantar fasciitis. It was just irritation of the sciatic nerve. And when you'd put pressure on it, it really lit her foot up. And what I had her do is, in her instance, I had her turn her head to the right and put pressure on it, and it got rid of all the pain. So we knew it was actually coming from the neck.
Which was the coolest thing, because she's like laying there like, you're like, turn your head to the right or the left.
Yeah.
And she's like, she like, turn your head. And then you asked her,
if she felt it.
Do you still feel that pain? She's like, no. I'm like, it's the craziest thing.
Yeah, and it's all just taking pressure off the spinal cord. So her vertebrae was out of place. We fixed the muscle in the neck that holds that vertebrae in place, took pressure off the spinal cord, and took the irritation off of the nerve that travels all the way down from the spinal cord into the foot. And we fixed her foot by fixing one muscle in her neck.
It's the coolest thing to learn this stuff. I mean, for me, like, I think it's so fascinating that, I mean, you really do make the entire body work as such a whole.
Yeah,
you know,
you have to, or else you can't do it. You won't get the results that people are looking for unless you look at everything, because everything's all connected in the body.
Well, I want you guys to know, because I would have never ever thought anything like that. But when you say it, I'm like, well, that makes complete sense. And I mean, this happens all the time. Now, you saw my Alexis for the same thing. It was probably 2 months prior to this one. And when I brought her back last week, this was the first time since you treated her 2 months ago that foot bothered her.
Okay, good.
So it's just amazing that one treatment, you got it, you know?
Yeah.
And then I do want to share with you guys, too, on this visit with her, she has accumulated some acne on her forehead that you're treating her liver for, and she is clearing up so well. It's
good.
amazing.
I'm glad to hear it.
I didn't even tell him that. So I didn't even tell him that yet. Good. But it's just so cool that it's all working as one.
Yeah.
You know, and I don't think, because we think, well, I need to go to a specialist for my foot, or I need to go to a specialist for my stomach or my lungs. We don't think our bodies works, you know, in conjunction with everything.
Yeah. So you need a specialist for the system.
Yes.
Yeah.
It's just absolutely amazing. Okay. So one of the things so here I'm being selfish.
Here we go.
I love the go lives, right? Because I get to find out stuff I really want to know. I mean, it is on this topic, but a lot of women are suffering with like dry, cracked feet, especially like their heels.
Yeah.
Can we do anything about that? What is the best thing to do? Why is that happening?
It's one of two things usually. It's either a fat absorption issue, so the body's unable to break down fats properly and absorb them, which would be related to the gallbladder. So gallbladder deficiency, or it's just not working 100%, or they're not consuming good fats because of the worst, dumbest dietary craze in ages, the low-fat diet that started in the 80s. That's complete garbage. But since then, people haven't been eating fats much, so there's probably an increased likelihood that you're going to have cracked heels. Now, you'd want to eat fat because that fat is needed to heal and repair your skin. Now, it could be a collagen issue too, or repairing the skin with like vitamin E or vitamin C. Vitamin C is needed for collagen production, and vitamin E is just good for restoring the integrity of the skin itself.
So these would be like ingested supplements, not topical.
You want to eat. It's coming from the inside. You want to eat fat. You can put fat on your heels if you want, like coconut oil or something like that. I mean, that would help. But you want the internal process to be corrected for it to present properly externally, like on your skin. So usually it's going to be fat to start with. You want to make sure your gallbladder is working. So you could do a number of things to get your gallbladder working, but beets are very good for it, and lemon juice is very good for it.
For your gallbladder.
Yeah. And so there's some things you can try, but consume more fats. So we're talking about good fat like coconut oil, avocado oil, animal fats from animals that are raised in the pasture eating what they should eat. Those are good ones. And then vitamin E. So you can get that from wheat germ oil, which is a good whole food source, or a number of other. Just kind of search online for foods that are high in vitamin E and pick your favorite ones, because everyone's just different. And the same thing for C, vitamin C.
Okay, and then one last thing I have for you guys. Like, I know a lot of people are putting and recommending using essential oils for your feet. And especially this time of year, I always see those, they're like just campaigns on putting onions on your feet to draw out toxins.
It actually does work.
Does it?
Yeah.
Like a cold?
Yeah.
So like if you have a cold, you could put an onion.
Yeah. There's something, I forget what it's called. I'll have to get back to you. But it's actually putting a cold sock on, hot sock on. If someone knows it, you let me know. But it's actually a way of getting rid of a cold. I've heard of it before, and actually a lot of people have said it worked. But yeah, feet are pretty amazing things. The reason why you'd put, like a lot of times whenever we're doing essential oils with our patients, a lot of times the absorption area, one of the highest absorption areas for that oil to get into the system will be the feet. And, whenever you may have heard of like foot baths and things like that people do detoxification foot baths. The reason why you're using the feet is because the feet can pass things in and out of it very easily. So feet are like, they're really good for getting things in and pulling things out. So a high absorption, like, portion of your skin. And it's amazing because the skin on the bottom of the feet's so thick, But, yeah, it's a great way specifically, like we like to use the bottom of the big toe for some oil applications just to get them in the system faster.
And I have to tell you, the one go live we did was, I think we did it on like parasites and stuff. But it was so funny because you had said that you know it.
Yep, you can, parasite eggs can travel right up your feet and into your skin, and
they're most
get in the body
active
at night and in the early morning. So if you have any animals, like even squirrels or chipmunks running around the yard and you're walking around barefoot, there's a good chance you might pick up a parasite.
I do not leave my room now in the morning without...
Is that how you wanted to end this go live?
I do not leave my bedroom in the morning without putting socks on because we have a cat in the house.
Yep.
And it's just the craziest thing. I know. And I had something else. I didn't want to end on that note. I had one other thing for you. It was essential oils, our feet. No,
Looks like we're ending on parasites.
We're ending
traveling through your feet.
On parasites. Oh, no, we do have a question.
Okay.
We had a question earlier today on our Facebook.
Great.
Yes.
Throw it at me.
So let me find that.
Okay.
In the meantime, you guys can always reach us. I'll put a little plug in while I'm looking for it at 724-205-6260. I'm always afraid of giving you the wrong number right when we're live, right? Because
be careful.
What an awful blooper that's going to be.
We'll have a blooper reel someday, I'm sure.
I'm still looking. I'm sorry, guys. So we did have a question. If you guys ever have questions that you want the doctors to ask, just send them to us. And even if you have a topic that you want to hear more about, I love putting them on a spot. So anytime you guys want that to happen, you can shoot me a DM.
It'll just be one more hour. We'll be right with you.
All right. Pain that feels like a broken ankle. Bones rubbing together, but x-rays show no break or arthritis.
So the question is what would cause that?
I think the question is what could cause that, and I think we always want to know, can you help it?
Well, something like that, if it's not showing up on an x-ray, it's going to be soft tissue problems, and that would be more of, I would guess, just from clinical experience, the attachment point of either a muscle to a bone or a ligament, well, muscle to tendon to bone, or ligament to bone. So ligaments hold these guys, the bones, together. So it's going to be an attachment point. And the best thing for an attachment point issue, so those things are really painful when they're lit up. It could have been like a slight tear or have little micro tears in them or on them. So one of the best things that you could do would be actually to eat raw potatoes. Because it has something called phosphatase in it. When you cook a potato, it doesn't have phosphatase in it, but phosphatase helps speed the healing of the connection points between muscles or ligaments, tendons to bone. And doing that for maybe give it like a week and a half, one raw potato a day, give it a shot, and hopefully that helps. If not, we could probably help you with that.
I'm really going to get on this girl about this raw potato because I really do want to know.
Okay.
That is an awesome, that's awesome. Take one potato, call us in the morning.
Eat a potato a day.
Eat your potato a day. Hey guys, thank you so very much for spending your time with us. Just let us know if you guys want to hear anything else or have specific questions for the docs that I can help you with. And we will see you next week. Bye.
See you later.